Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Cardiovascular disease is the world's leading cause of death. And at the center of that risk sits one familiar culprit: elevated LDL cholesterol. Decades of evidence show a simple truth. Lower LDL cholesterol level means better cardiovascular outcomes. A meta-analysis study showed that for every 1 millimole per liter reduction in LDL cholesterol levels, there is a 22% decrease in cardiovascular disease events. Yet, despite the availability of statins and other lipid-lowering therapies, many patients still fail to reach LDL cholesterol targets. Some cannot tolerate treatment. Some struggle with adherence. Others begin with cholesterol levels so high that standard therapies are simply not enough. This unmet need has driven the search for new strategies. Not to slow cholesterol production, but to help the body remove LDL more efficiently. And that is where Lerodalcibep comes in. In December 2025, the U.S. Food and Drug Administration approved Lerodalcibep, a once-monthly subcutaneous injection, as an adjunct to diet and exercise for reducing LDL cholesterol in adults with hypercholesterolemia, including those with heterozygous familial hypercholesterolemia. In this video, we will break down how Lerodalcibep works. By targeting one of the most important regulators of cholesterol clearance in the body, the PCSK9. Let's start with normal physiology. LDL cholesterol circulates in the bloodstream packaged inside LDL particles. The liver, specifically liver cells called hepatocytes, play the central role in clearing these particles. On their surface, hepatocytes express LDL receptors. These receptors bind LDL particles and pull them into the cell through a process called endocytosis. Once inside the cell, LDL particle is sent to lysosomes and broken down. The LDL receptor is normally recycled back to the cell surface. This recycling allows a single LDL receptor to clear hundreds of LDL particles over its lifetime. Efficient LDL receptor recycling is therefore essential for maintaining low plasma LDL cholesterol levels. Now enter PCSK9, or proprotein convertase subtilisin, Curson type 9. PCSK9 is a protein produced primarily by the liver and released into the bloodstream. Its role is to regulate how many LDL receptors remain available on the surface. Here's what happens. PCSK9 binds to the LDL receptor on the hepatocyte surface. When the LDL receptor PCSK9 complex is internalized, the receptor is sent to the lysosome. Instead of being recycled, the LDL receptor is destroyed. The consequences are straightforward. Fewer LDL receptors on the liver, less LDL removed from the bloodstream, and consequently higher circulating LDL cholesterol. PCSK9, in effect, acts as a brake on the liver's ability to clear cholesterol. Lerodalcibep is a third-generation PCSK9 inhibitor designed for once-monthly, self-administered subcutaneous dosing. Unlike earlier PCSK9 inhibitors such as alirocumab or evolocumab, which are monoclonal antibodies, Lerodalcibep is structurally different. Lerodalcibep combines an adnectin that neutralizes PCSK9 with an albumin-binding domain that extends its half-life and allows for monthly dosing. But structure aside, the key question is simple. What does it do? Lerodalcibep binds PCSK9 in the bloodstream and prevents it from interacting with LDL receptors. This sets off a clear cascade. PCSK9 can no longer escort LDL receptors to lysosomal degradation. LDL receptors recycle normally back to the hepatocyte surface. The number of functional LDL receptors on the liver increases. Hepatic uptake of LDL cholesterol rises. And plasma LDL cholesterol levels fall significantly. Importantly, Lerodalcibep does not block cholesterol synthesis. Instead, it enhances the liver's natural ability to clear LDL from the circulation. The FDA's decision was based on data from the global LIBerate clinical trial program, which enrolled more than 2,900 people. These included individuals with established cardiovascular disease, those at high or very high cardiovascular risk, or patients with inherited hypercholesterolemia, including heterozygous familial hypercholesterolemia. Patients gave themselves an injection of Lerodalcibep once monthly, for up to 1 year. More than 2,400 people continued into a long-term extension study lasting approximately a year and a half. Across studies, Lerodalcibep lowered bad LDL cholesterol by at least 60% in people with cardiovascular disease, or a high risk of it. In people with heterozygous familial hypercholesterolemia, who usually start with much higher LDL levels, the drug still reduced LDL cholesterol by about 50% or more. Overall, the treatment was well tolerated, and no serious side effects related to the drug were seen during the long-term studies. To summarize the mechanism in one sentence, Lerodalcibep lowers LDL cholesterol by binding PCSK9, preserving LDL receptors, and increasing hepatic clearance of LDL particles from the bloodstream. This is receptor preservation rather than synthesis inhibition, a fundamentally different pharmacologic strategy. PCSK9 inhibition has reshaped lipid-lowering therapy. It represents an evolution in this class, combining molecular targeting with durable once-monthly control. And for patients still struggling to reach LDL goals, the difference matters. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.